Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the world and return the knowledge to the world. Motto of my life is learn, earn and return. I have learned a lot, earned a lot. Now it is the time to return a lot to the world. The topic of today is hyperthyroidism, and it is also called grave disease. If you look at this diagram, that is the thyroid gland, it is hyperfunctioning thyroid gland, and a large thyroid gland is called goiter. If you look at this diagram, here is the normal thyroid gland size, and here if you see the enlarged thyroid gland, which is definitely larger than this normal thyroid gland. Now, hyperthyroidism or grave disease, synonymous is the other name is overactive thyroid or hyperthyroidosis. Here, thyroid gland makes too much or excessive thyroid hormone. In thyrotoxicosis, there is excessive thyroid hormone of any cause, and it includes hyperthyroidism. So terms these thyrotoxicosis and hyperthyroidism are used interchangeably sometimes. Hyperthyroidism speeds up the body's metabolism, causing the symptoms like hand tremors, irritability, muscle weakness, and sleeping problems. There is fast or irregular heartbeats, heat intolerance, diarrhea, enlargement of the thyroid gland, and sometimes there is weight loss also with that. Complications are thyroid storm, that is a serious emergency, and the usual onset is 20 to 50 year of age group people are affected. Here one can see the position of the thyroid gland, as the trachea do have the thyroid cartilage, and below that is the thyroid gland, and here are the prominences which one can see, and these are the nodules, and here if you see the thyroid from behind, there are 4 parathyroid glands which are embedded in the mass or the substance of the thyroid gland. And in this hyperthyroidism, there is too much hormone, which is T3 and T4, that is produced by the overactive thyroid gland. And here again, one can see too much hormone, T3 and T4, is produced by this gland. Now, causes of hyperthyroidism are grave disease, multinodular goiter, toxic adenoma, or inflammation of the thyroid, eating too much iodine or too much synthetic thyroid hormone are also among the causes. Diagnostic method is based on symptoms, and it is confirmed by the blood test and the imaging sometime. Treatment is several treatment like anti-thyroid medicines like beta blockers and methimazole, which just lowers the activity of the thyroid gland as a whole. Radioiodine therapy to slow the production of the thyroid hormones, and sometimes surgery to remove all or the part of the thyroid gland. Here, if you do see the thyroid system, there is hypothalamus, which is just having a hormone which is called TRH, thyrotropin releasing hormone, which act on the anterior pituitary gland, and in response the anterior pituitary gland produces the thyroid stimulating hormone, which is the TSH, and this TSH act on the thyroid gland, and that is just the release of thyroid hormone. T3 and T4 are excessively or normally according to the stimulation. There is increased metabolism, growth and development, and increased catecholamine effect. Now, if there is excess thyroid hormones T3 and T4, they can, by the negative feedback, they can just suppress the anterior pituitary gland to control the TSH, and they can also act on the hypothalamus to control the release of TRH, which ultimately causes the release of TSH and ultimately the T3 and T4. Now, epidemiology, it affects about 1.2% of the population of the world. 50% have obvious symptom, while 50% do not have symptom, means asymptomatic. It occurs more often in women, as women have to have the more body stress in case of menstruation and the childbirth and the lactation, so they need more thyroxine, and that is just there is production of more in case of stresses. Onset is between 20 and 50 years of age, more common in the age of 60 years. Subclinical hyperthyroidism increases the risk of cognitive impairment and dementia. Now, history of this disease. Caleb Hillier Perry first noted association of the goiter and the protrusion of the eyes in 1786, but published his finding in 1825. In 1835, Irish doctor Robert James Graves also proved link between protrusion of eye and the goiter, so giving his name to the autoimmune disease now known as the Graves disease. It is just the name of Dr. Robert James Graves. Here one can see Caleb Hillier Perry, and that is the Graves disease, and that led to the Perry-Romberg syndrome. And then Robert James Graves, that he, the pioneer of Graves disease discovery and also the Graves of thermopathy. Now, certain risk factor. A family history of the thyroid disease, particularly Graves disease, female sex, a personal history of certain chronic illnesses, including pernicious anemia and primary adrenal insufficiency, a recent pregnancy. These are all responsible risk factor and leading to the more problem of the hyperthyroidism. Now, what are the causes of hyperthyroidism? These are by the age, entire gland or the single nodule called a hot nodule is overproducing the thyroid hormone in the thyroid gland, otherwise normal. Thyroiditis, that is the inflammation of the thyroid or functional thyroid tissue, produce an excess of the thyroid hormone. So number one is the Graves disease. It is an autoimmune disease cause 50 to 80% of the hyperthyroidism, and it varies with the location. Antibodies stimulate thyroid and produce more T4 hormone. Reason is the varying level of the iodine in the diet. It is 8 times more common in young female around 20 to 40 years of age. Number 2 is the toxic thyroid adenoma. Seen in 53% cases, reason is the low level of dietary iodine that produces more T4 in response to low level of thyroid iodine. Hyperthyroidism and Graves disease that lead to the myxedema, exophthalmos, and toxic multinodular goiter, and here one can see the thyroid adenoma, and here that is the toxic multinodular goiter, as one can see the many nodules, and here that is the thyroiditis, the inflammation of the thyroid gland. Antibodies attack the thyroid cells, and the damaged cells leak the hormone, leading to the hyperthyroidism. Now, the third cause is toxic multinodular goiter, also called toxic adenoma or plumber disease. Reason is the hyperthyroxinemia, that is more thyroxine in the blood. The fourth is thyroid inflammation called thyroiditis, like Hashimoto's thyroiditis. It is immune-mediated disease, and subacute thyroiditis that is seen in the Quervian's disease. First, there is hyperthyroidism, then it is going to cause sometime the permanent hypothyroidism, need the hormone replacement therapy. The fifth cause is oral consumption of excess thyroid hormone, as in case of ground beef contaminated with the thyroid tissue in hamburger thyrotoxicosis or elementary thyrotoxicosis. And number 6 is the drugs, that is amiodarone. It is an antiarrhythmic drug. It is structurally similar to the thyroxine, so act like a thyroxine and to cause overactivity of thyroid gland. So here one can see the hamburger thyrotoxicosis that is contaminated with the thyroid tissue, and that is amiodarone antiarrhythmic drug. Then there are certain diseases that is called stroma ovarii, that is sometimes called ovarian goiter also. This tumor in the ovary produces the thyroid hormone more and causes. Then pituitary adenoma, as one can see, that is responsible for producing more TSH and ultimately more thyroid hormone. The 7th is postpartum thyroiditis, PPT. It occurs in 7% of the women. The thyroid gland becomes inflamed after the pregnancy due to an autoimmune condition and causes the more T3 and T4 production. Stroma ovarii, or the goiter of ovary, I have shown the diagram, that is monodermal teratoma that contains thyroid tissue and produces the T3, T4 abnormally. Excess iodine consumption from the algae such as kelp or from the supplement which contain iodine. 10th is taking too much thyroid hormone, as in case of certain diseases one do use more levothyroxine, so that is called exogenous thyrotoxicosis. Number 11 is pituitary adenoma, that is causing hypersecretion of the thyroid stimulating hormone TSH. Already I have shown you the diagram, and that is going to stimulate thyroid to produce more T3 and T4. Other causes are metastatic differentiated thyroid cancer, metastatic tumors within the thyroid gland that can just increase the activity of the thyroid gland and causing the hyperthyroidism. Now, the summary of the causes of hyperthyroidism: number 1, injury to the thyroid gland, and then some medication, amiodarone I have shown you, hereditary, the family history, then inflammation of the thyroid gland, Hashimoto's, hormonal changes, that is miscarriage, pregnancy, irregular sex life, and menopause that also disturb the thyroid, damage to the pituitary gland and ultimately affecting the thyroid gland indirectly, then infectious diseases and severe nerve shocks. These are all responsible causes of hyperthyroidism. It is not the strongest of the species that survive, nor the most intelligent species, but the one most responsive to the change of the world and change of the environment and adapt themselves according to the situation. These are the strongest species which do survive, said by Charles Darwin. Now, signs and symptoms of the disease. They vary between people may be asymptomatic or with significant symptom. Thyroid hormone do normal function of the cells in excess, overstimulates metabolism and sympathetic nervous system. It speed up the various body system and the symptoms like one do have if the overdose of adrenaline injection. Classical symptoms are less severe in elderly and during the pregnancy. The symptoms belongs to the cardiovascular system. There is fast heart rate, that is tachycardia, irregular heartbeat, that is arrhythmia, or the palpitation, that is more than 90 beats per minute. Digestive system, hypermotility, vomiting, diarrhea, weight loss with increased appetite, and in 10% of people there may be rarely the weight gain. As one can see, increased appetite one do eat more, that is inability to concentrate, then irregular heartbeat and difficulty in sleeping, and there is itching and there is hair loss, especially 1/3 of the little part of the eyelid. Now, sign and symptoms in skin, there is heat intolerance, hair loss, especially of the outer third of the eyebrows, thinning of the skin, fine brittle hair, muscle aches, fatigue, muscle weakness in the upper arms and the thighs is seen. There is swelling of the thyroid gland, a goiter is prominent. In the nervous system, there is tremor of the hands, chorea, anxiety, nervousness, increased perspiration means more sweating and delirium. Panic attacks, there is inability to concentrate, sleeping problems, memory problems, and periodic paralysis is noted. Psychosis and paranoid condition is seen in the thyroid storm and menstruation problem. There is disturbed inflow and cycle is seen. So here one can see the symptoms of the Graves' disease. Graves' disease is the most common cause of the hyperthyroidism, which causes the following symptom, and in 80% cases the cause is Graves' disease. Rapid heartbeat, palpitation, increased appetite, weight loss, feeling shaky and nervousness, there are tremors, diarrhea or more frequent bowel movement. Continuing the sign and symptom, there is low serum cholesterol and high blood sugar. So most of the patients do have the diabetes in later life. Pretibial myxedema, that is the sign of Graves' disease. Association between thyroid disease and myasthenia gravis is very much there. And in Graves' disease of ophthalmopathy, eyes to look enlarged, exophthalmos as eyes muscle weak, and immune-mediated inflammation in retroorbital fat that push the eyeball forward. Eyelid retraction or the stare, extraorbicular muscle weakness present with the double vein. There is lid lag, that is von Graeff's sign, or Dalrymple sign. The eyelids are retracted upward and more than normal, and in lid lag, when the person tracks an object downward, eyelid fails to follow the downward route. And here one can see the enlarged thyroid, the goiter, and normal thyroid and the goiter. Here one can see also. And that is the graves of ophthalmopathy. There is a bulging and reddened eyes, as one can note, the prominent and bulging eyes. And there are certain eye signs which have been seen in this disease. That is mostly the Rosenbach signs. There are tremors on closing the eyelids. Then Stellwach sign, staring look with infrequent blinking. Then Dalrymple sign, that is a rim of the sclera is seen between the cornea and the upper lid, as one can see here. Von Graff sign, lagging of the upper eyelid, that is not able to follow the direction of the eye. Then Geoffroy sign, the loss of forehead corrugation when looking up. And Mobius sign, there is lack of convergence due to the ocular myopathy. Now, symptoms of the hyperthyroidism in summary: there is dyspnea, corneal erosion, pain in the eyes, lacrimation, heart rhythm disorder, tachycardia, thirst, copious urination, increased appetite, indigestion, diarrhea, abdominal pain, and hypertrophy of the muscles, tremors in the body and limbs, development of the osteoporosis in bone, and infertility, meager menstruation, decreased potency, and sweating, making the gray hair early, and irritability, anxiety, depression, and insomnia. These are all the symptoms of hyperthyroidism. Now, what are the complications of the hyperthyroidism? Number one is the heart problem. That is the most serious complication. It includes the heart rhythm disorder, which is called atrial fibrillation. So there is increased risk of the stroke. Congestive heart failure means heart cannot circulate enough blood for the body's need. Brittle bones, weak brittle bones called osteoporosis. Strength of the bone depends on the amount of the calcium and the other minerals inside the bone. Too much thyroid hormone impairs the absorption and entry of the calcium into the bone, so the bone becomes brittle and osteoporotic. Discolored, swollen skin. Rarely, people with the Graves' disease develop Graves' dermopathy. Here, the skin changes its colors, redness, and the swelling on shins of the legs and the feet is seen. Continuing the complication, number 4 is the vein problems called thyroid eye disease or the Graves' ophthalmopathy. It is seen more in the smokers. Muscles and the tissue around the eyes are affected. Bulging, inflamed, red, swollen eyes are there. Puffy, retracted eyelid, gritty sensation or the pain, light sensitivity, and double vision is present. If untreated, it may cause vision loss also. Number 5 is thyroid crisis or thyroid storm. It is a severe form of thyrotoxicosis. It is a medical emergency. Here, an infection results in the symptoms like rapid and often irregular heartbeat, high temperature, vomiting, diarrhea, dehydration, mental agitation, delirium, and confusion. And it is causing the death in 20 to 50% of cases. Now, these are the symptoms of thyroid storm: high fever, agitation, delirium, congestive heart failure, loss of consciousness, and ultimately one can have the death in 20 to 50% cases. Now, thyroid disease in pregnancy. Thyroid hormones are naturally elevated during pregnancy because of increased demand of these hormones, and it normalizes by the second trimester without any treatment. This hyperthyroidism must be distinguished from the gestational transient thyrotoxicosis, which occur in response to the pregnancy. There is high maternal free T4 levels during pregnancy, which cause impaired brain development of the coming fetus, which is independent of HCG level. Now, effects of the thyroid disease on the pregnancy, on fertility, menstrual cycle abnormalities which can affect ovulation and definitely lower the infertility. On the mother and baby could lead to the serious complication like miscarriage or fetal tachycardia if left untreated. So these are effects of the thyroid disease on pregnancy.